Here, as usual, I told you initially the main thing is acquisition of the image. Okay, in what is they are going to accuse, what image they are going to capture in a blood. So even for this determination of the blood group, what they are taking the blood. No, that blood we have to take it as a images, and that blood sample images we have to make in terms of the color plane extractions, and then we have to follow the thresholding, a morphological operation, and HSL luminance. We'll discuss HSL luminance later, and quantification, blood group. Finally, with these operations, we are going to identify the blood group. We are going to determine the blood group. This is some of the samples of the blood. This is the blood samples. Okay, generally, we know when you are identifying the blood group, basically we'll be having a B, and O. With that, we'll be having A positive, A negative, B positive, B negative, and AB positive, O. So basically, we are going to take us as a three main A, B, C. Okay, and with that A, B, C, we can form as A positive, B, B positive, A, B positive, AB negative. So only the three is taking a major part, and with that, these four major. This is a main blood group which will be present. Excuse me. Based upon the presence and absence of the antigen of the surface of the red blood corpuscles, we can identify the blood group. When you take the A positive, that is not A positive, group A category, with that we have to add the A antigen cells. Only A antigen cells will be we can determine, and AB means both the A antigen and the B antigen cells will be present, and in a O there is neither an R nor a B will be present. So based upon this compatibility of the blood transformation is done, and we can identify the blood groups. If you take this is blood samples, and how we are going to identify in the sense, with this some gels will be applied on the antigens will be applied, and with that this is a RBG image, RBC image will be taken, and this is segmented, and the edge will be detected, and which is going to identify the, by using the antigen cells presence, we are going to identify the blood group. Second one is pre-processing. That is when you are going for any blood identification, blood determination, or the diagnostic of the sugar, that is diabetic. Pre-processing is very very important. Okay, so we are taking in terms of the pre-processing after a sample and detection with the device, and we have to go for the mask calculation, and which mask will be suitable for this image, that we have to select, and we have to go for the calculations, everything we have to do with the morphological operations, and all we have to do, and then we have to finish whether which is matching with this image or previously stored image or not. Okay, that we have to do. This is a basic diagram, basic block diagram. The second topic what we have seen is that diagnosing the diabetic retinopathy from funds photograph, which is a for the diabetic patients. The first one is initially the retinopathy will be that is high sight will be reduced, and next they'll be giving the symptoms. Is it eyesight? If the eyesight is reduced, and if you go, if you have the um, any distance objects which is visible or not, and the somebody is having the reading capacity will be reduced, the high sight will be getting reduced. So we have to go for the retinopathy dia from the funds photograph. The photographs we have to take from the eyes, and that from that we have to identify, and which is taken from the three features. Main is the optic disease, another one is the fovea, and the third one is the vessel structure. These are all the three main features we are going to take as the diabetic retinopathy for fundus photography. This is a first one as the after taking the images we are going to do the pre-processing. This image is a pre-processing of the retina, and the second one is the first one is the pre-processing. This is a original image. With this we have a pre-process. So when you see this with original image and the second image, pre-processed image, we can see this part will be taken as clearly this, so that we can identify the diseases easily. Location of optical disc. See, in that first one is the what I told is the first process is a optical disc. After doing the pre-processing, we are going for the optical disc. Second one is a fovea, and the third one is visual structures. So first we are moving into the optical disc. So by using the segmentation process, here the main task is segmenting with the brightest part. Okay, so this brightest part will be segmented, and which is taken, this is the original image and this is the segmented image what we are going to take. This is the location of optical disc. After we find out the diseases, so this segmentation will be technique will be used for optical disc. And next was the fovea and muscular locations. And this is actually this part is a fovea and muscular in the tissue of the eye. If suppose any injury, the lesion will be there, that we have to find out. And that will by using the this A is the original image. By using the segmentation, we are going to take accurately presence or not, that we have to do. For that we are locating that. And a final one is the vessel extraction. This will be coming under the structure also. This vessel extractions are now will be taken, and again here which will be taken as a segmentation, and the edge detection part will be taken to identify this vessels. And so that see, this was the normal image, original image. With this we can take the vessels image. Vessels will be extracted properly by using the segmentation and the edge detection. And next one is the extraction of dr pathology. And here see, this is by using the segmentation, the high spot images, high spots will be, these are all the lesion parts, the high spots will be identified, and which will be taken it separately. This is the original image. With this high spot, with the intensity and luminous will be taking, this is the part, this is a lesions part. And all this process, we have a image enhancement, we need the image enhancement, and then only we can go with the image segmentation. See, image enhancement is basically improving the perception of the information in the image for human viewers, and providing better input for further for the image processing technique. That means when you view the image, ordinarily when we view one image which will be appears normal, and we wanted to see the accurate, we wanted to see the lesion disease identification, definitely we need the enhancement would be needed. For basically we'll be using the mobile phones. If we are not properly, if we are going to see any images, what we will do, we will be enlarging our images and we'll be seeing, is it? Similarly here, image enhancement will be improve the perception of the information in an image. That means information contains the pixels of the pixels and the neighborhood pixels, and that spot particular image, particular lesion part we are going to take, and which is going to get it in terms of the further processing. For that, only image enhancement is required. uh, Basically we have a two image enhancement technique. One is a spatial domain, other another one is a frequency domain. Um, we'll see about the spatial domain and the frequency domain. Enhancement technique, first we'll deal about the spatial domain. The images which is deals works on the image plane itself is actually a spatial domain, and the which is actually directly manipulated within the pixel of the particular image. And next is a frequency domain. In a frequency domain, modified Fourier transform coefficients will be taken, and the inverse Fourier transform will be taken to and also to modify the coefficients, will be getting the enhanced image. Yeah, basically the spatial domain what we have dealt is the what I have told is a work on the image plane itself, and that means the pixel manipulation has to be done on the images within the pixel only we are going to do it. So for example, if you are taking as a f of x comma y is the original image, in the sense that image will be transferred, the transformation is directly fall on that particular image, that will be reflect on the g of x comma y, that is s is equal to t of r. For the spatial domain, we can go with the point processing, histogram processing, and mask processing. These three terms, point processing, histogram processing, and the mask processing. These three processing will be directly deals with the image pixels. We'll see about the point processing. This is actually a spatial domain. In this, if we are considering, this is the f of x comma y. Within this f of this is a f plane, and within that x comma y is a pixel. If I wanted to do anything, I'm going to take the part of the pixel, and I'm going to change this, and also I'm going to change the neighborhood of this pixels, the x minus 1, y minus 1, x plus 1, like that I'm going to take the, if I'm changing any pixel, the particular neighborhood pixels is also get changed. So this is an example of 3 cross 3 neighborhood pixel, the example of f of x comma y within that pixel manipulation. This point processing, this is point processing with that f of x comma y is going to deal. And in this point processing, any transformation is taken in terms of the image, that is directly with that pixels. Okay, here if I go with this, and this is of dark and this of light, which is going with the my r value is increased, which is in terms of the right, when my r value is decreasing, which is reaching the zero, which is in terms of the dark. So this the transformation of this r will be directly implies in of the s. If I'm going with the black and white image, either a 0 or 1, in the sense which is going to show like this. This is actually slightly gray to dark image, gray to black, white, so that which is going to show this. If I'm going for this dark and the light, like black and white image, if I'm going to take, at the time I'm going to get the my value is a 0 or else in a 255, I'm going to get a 0 and 255. Like that also I can change my image for the pre-processing. To enhance my image, I can use this point processing. And all these things I have to go for the enhancing my image, to show the lesion part, to show the diseased part. I wanted to use all these techniques. So what I'm going to use, I'm going to use the next one is the mask operations. If I'm going for the mask operation, I have a plenty of mask was there in a image processing. For example, I'm going to tell you the 3 cross 3 neighborhood, this mask, 3 cross 3 mask I'm going to show. uh, Take this mask, which is a w of 0 comma 0. This is the first pixel. This mask is the is embossed onto the original image of image, which is going to take it in terms of the 3 cross 3 I'm going to take. So this also f of x comma y also I've taken in terms of the 3 cross 3 image. So I'm going to place this mask on the top of this image, on this image. So this will be multiplied by my original image, I'm going to get it. So my value of the final output is g of x comma y is equal to, I'm going to get in terms of the summation over minus 1 to 1, and this j is equal to minus 1 to 1, with the mask weightages will be multiplied with my original image pixel f of x plus I comma y plus j row, and this is what in terms of the row and column, and the row and column of the weightages will be multiplied with my original image of f of x comma y. Like this only every mask will work on the image. So what we have to do is, if the mask has to move row by row or else column by row by row and also the column by column to get the enhanced image. So we have to move this mask by row wise and also by column wise. Again the point processing with the digital negative image. Here is the image for this. Now what we are going to deal with the cancerous image. So this is a breast cancer image, and which is that digital negative, a negative processing we are going to apply. Then a point processing digital negative we are going to apply. So s is equal to t of r. So we are going to give it in terms of the transformation of r will be in terms of the l minus 1 to the r with this l minus 1, so that the point to point there will be, which is going to take it in terms of the l minus 1 minus r. So the input image of this, when we apply this point processing technique in this image, with this image, so what we are going to get in terms of this a black dark spot will be moving over there, and we are going to get it in terms of the light. Okay, so we can accurately get the lesion parts. With that lesion parts, again we have to enhance and we have to identify whether this is a diseased image or not. What we are going to do with the identification of all these components diseases, we are helping the doctors to get the accurate data at the same time in a faster manner. Because if the patient will be taking any diagnosing any CT or else MRI, whatever it may be, they will take in one day, and after that they have to give it to the radiopathologist and they have to get the concurrence and they have to give. So what we are going to do, we are going to train our system to make it in terms of the faster and earlier detection. Because for the cancer and our earlier is the detection, earlier will get the disease will be cured. So that earlier detection is very very important for the cancer patients. So we are moving into this image processing techniques. So we can do this as a startups, and we can help doctors, and also we can help the society. And see next special domain method, one of the one important method is a logarithmic transformation. And that logarithmic transformation, y is equal to c log base 10 of 1 plus x. This is a formula for that, and this is a graphical representation of that. And when you take the x-ray image of the femur image, see this images which is not identified proper, give the logarithmic morphological enhanced method for the femur image. We can view this parts accurately, so the doctors can be identifying easily. Okay, the next is the chest image, the lung image. In that lung image, we can, if you are applying the logarithmic morphological, we can see this bones, everything will be and accurately, so that the chest, any any other diseases there means we can identify easily. Like even a cancer images, a lung cancer and all, we can view easily. Yeah, advantages. These are all the points of the logarithmic transformation. The logarithmic morphological transformations, uh, which is going to present above, are very useful to acquire the medical image, because automatic contrast and enhancement and sharpening is needed for the x-ray images and the mammogram images, computed ct images, MRI images, and sometimes it will be used for the telemedicine applications. So the logarithmic transformation is taking the main application of these images, digital mammography X-ray. As you've seen here, this is a femur image, and this is a lung image, and also this is uh, cancer mammogram image. So which is applying, when you are applying logarithmic transformation on these images with this enhancement, which is enhance the image with the contrast and the sharpening. Some image will be needed in terms of the sharpening, so that will occur in with this logarithmic transformation method. And the most important performance of this logarithmic morphological models are, that's what earlier what I said, sharpening and the contrast. So sharp, that in that sharpening, compensation for the blurring introduces into the image by image formation process. This allows fine details to be seen more easily than the before. As you've seen here earlier, see this is a original image. When you apply this image, we can see the accurate results. The fine particles, fine images will be taken it clearly. That's what we are going to use the logarithmic transformation for the sharpening. This allow the fine details to be seen more easily than before. And next is the dynamic range of compression. The Because we are going to use it for the telemedicine purpose. When you are using for the telemedicine, compression will be taking a main part. So the ability to represent a large input dynamic range into a relatively small output dynamic range. Whenever when you're using the telemedicine, there definitely compression, and with that compression, the accuracy should not affect. So that we are going for the logarithmic transformation. And next is a color constancy, the ability to remove the effects of the illumination from the subjects. This allow consistency of outputs as illumination changes. And another method is a power law transformation. In the power law transformation, this is the formula: g of x comma y is equal to c into f of x comma y into a gamma, power of gamma. And the short form of representation of this, s is equal to c into r of gamma. This non-linearity is encountered during the image capturing and printing, also displaying, can be corrected using this gamma correction. Sometimes when you are capturing the images, unwanted things will appear, and some blurredness and something will be appear. Accuracy of the image, we won't get it properly. So at that moment, we can use the power law transformation for this, that images that is occurred by this gamma correction only. So hence this gamma correction is important if the image need to be displayed on a computer, because we need it in terms of the clarified image. So power law transformation can be used to improve the dynamic range of the image. And this is the example of the power law transformation. See here, this is a original image. With this original image, this gamma corrections will be applied, so that image accurate, some parts will be taken, this parts will be removed, and we have got this accurate results. So power, when we change the gamma corrections or gamma value, we will be getting the result in terms of the sharpen. And next one is in processing itself, enhancement processing. The main thing is contrast stretching and grain level slicing, bit plane slicing. Well, these are all called as a piecewise linear. contrast stitching, gray level slicing, bitplane slicing. We'll see all these things. What is a contrast stitching? Some images we need to contrast the images, and which is having the very low contrast means we have to make in terms of the, because of the poor illumination we'll be getting the aperture, due to the aperture also we'll be getting in terms of the very low contrast. So we have to stretching. The idea behind this is contrast stretching is to increase the contrast of the image by making the dark portion darker and the bright portion brighter. So for that we can use, this is the range r1 comma s1, and which is transforms, and which is transformed into a r1 comma s2. With this transformations we can get in terms of the contrast with the thresholding value. And this is some of the image contrast images. See, low and optimum and high contrast image by using the contrast stitching. The next one is a gray level slicing. In this gray level slicing is equivalent to the band pass filtering, which is a manipulated group of intensity levels in a image up to specific range by dimensioning rest or by leaving them alone. This transformation is applicable in medical images and also satellite images, X-ray images, and CT images. The third one is gray level slicing. In the gray level slicing, with brown background and the without background, we'll see what is with background and without background. So if you are taking, this is all the spatial domain, and in a spatial domain this is a pixel ranges. If you are applying with the background means, if you are applying the range, excuse me, s is equal to 7, and if we are applying our range will be which is lies between r1 and the r2, then which is going to take it in terms of the 7. If it is not, we have to make in terms of the as usual value, the s itself, which is will be s is equal to, if the range will be r will be ranges between r1 to r2, and which is s, at that time we have to make it in terms of the s7. Otherwise we have to make it into s, where your r1 and r2 value will be equal to, which is lies between 2 to 4. For example, see here the value is 2 to 4, in the sense we are going to replace by 7 wherever we have the range with the 2, 3, 4, then the value will be replaced by 7. The other, apart from that value, other values will be as such as the same. See here, 1, this is a 2, 2, 2, 2, so everything was 2 to 4 range, so which is replaced by 7. So what will happen with this, that is r1 and r2 will be equal to 4. For example, they have given this value, so within that value we are going to replace by a 7, other values will be 5. So with this, without any background, we are going to change the pixel value. And next, with without a background means s is equal to 7. Similarly, here also r1 is equal to 2 and r2 is equal to 4. R is lies between R1 and R2. At that time, it will be equal to 7. The other values, we are going to make it into a 0. See, as the previously with background, what we have taken, this is the resultant image. With this resultant image, what we are going to do, this value, the both the things we are going to change with the background and without background. With this also, we are going to make it into a 0. So the value which is lies between 2 to 4 is replaced by 7, and the values which is not lies with this value, that is equivalent to a 0. So this is the values of changing with the gray level slicing. Next one is a bit plane slicing. Bit plane slicing la, the we are going to split into a pixels into representations of the 8 bits, and with that representations, one second. Suppose each pixel is represented by the 8 bits. The higher ordered bit contains the majority of the visually significant data and useful for analyzing this. Why we are going for the bit plane slicing means, which is used for analyzing the relative portions of the images, relative portions of the each plane of the bits. This is a, so you see here the bit plane slicing. This is the original image. When we make into the first bit slicing bit image, second bit, and the third image bit, and when we are slicing the first the original image with the first bit image, second bit, third, fourth, fifth, the sixth, the seventh, eighth, so that we can get, this is the part we have to get, this is a highly intensity part we have to get. So like this also we have to enhance our image. Okay. This is the input image. When we are going for the brain tumor image, and for this aid detection on the low contrast medical images, this is a paper I've referred. And here what all the techniques we are using in the sense, first acquiring the acquisition of the image, that is the input image. Next, conversion to the gray images, and finally we have to go for the enhancement. When you are going for the image enhancement, we have to suppress the noise. Sure, we'll be having some noises will be present in a image due to the air, due to the moisture in the air. The image, while you are capturing, there will be a space in between the original image and the camera. So due to the noise and the moisture, air moisture, everything which will affect the patch, which will affect the images, so that also we will be getting the noises that we have to eliminate. So that noise suppression, for this noise suppressions we have so many filtering method: median filter, mean filter, a Gaussian filter, Wiener filter, whichever is suits for our particular image we can select. And then image enhancement. In the image enhancement, contrast enhancement, this is also the noise suppression and the contrast has to be enhanced with this. Next is the hedge map generation, the clusters formation, applying the hedge detection. For this edge detection, we have a canny, log, sopal, pre with robot. All these algorithms will be there. We can go with any algorithms. For this here example, they have used the canny hedge detection for the detecting brain tumor. And next one we are going to see is a histogram processing. This is also spatial domain, which is going to change the image with the pixels, and which will be as transformations on the image pixels, which will be m into r minus r minimum plus s minimum. And histogram equalization is a technique for adjusting the image intensity to enhance the contrast. For the image processing, a histogram will take a major part. For the enhance the contrast, when we apply the histogram stretching, and that is histogram processing, automatically the image quality will get increased. See, image equalization, this transformation that we need must satisfy the below two conditions. The first one is overall the condition it has to satisfy, in the sense s is equal to t of r, where the ranges of r between 0 to 1. And the most important thing is tf transformation of r must be single valued and strictly monotonically increased function in the interval of r is lies between 0 to 1. And the transformation of r, which is lies between 0 to 1, with the for the values of r which is 0 to 1, that is s value is also 0 to 1. For this r will be 0 to 1. Here the ranges will be taken in terms of the 0 and 1, which is called as a normalization range. And this is an example of the histogram processing. See here, same brain tumor image will be taken for histogram. This is a uh, gray histogram processing. With that, the pixel values will be taken, and look at here the pictures. This is a high intensity value will be coming over here. If we adjust these values, if we adjust with these values of these pixels, we'll be getting like this. So the ranges of the pixel value we change, will be getting the enhancement, contrast will be changed. Next, we'll move on to the color histogram. uh, in a histogram, we can also deal with the color histogram. Extract the color features, we have to go for the spacing, color spacing. And with this given into a color image, RGB image will be converted into the CAE image. And then the histogram is constructed from the CAE color space and stored in a database called feature database. These are all some of the example. In the future, we'll see what is CAE, what is RGB, what is HSA, all the things we are going to see. Yeah, when we are going with this spatial domain, definitely a neighborhood pixels we have to consider it. That is what the original image plane. This is the original image, that is f of x comma y. With that, we have to go for the um, neighbor pixels also. When you are dealing with any pixels, definitely that will affect the neighborhood pixels also. With that, with the processing, when you are doing it, we have to go with the smoothing filter and the shortening filter. Next, we'll move on to the frequency domain. So for what we have seen is a spatial domain. To enhance the image, we are going for the spatial domain. The next is a frequency domain. As I already told you, frequency domain is a Fourier transformer will be applied. So frequency domain is nothing more than the space defined by the value of the Fourier transform and its frequency variable u comma v. Here we have taken in terms of the f of x comma y, that is the original image, which is image will be, the pixels will be directly manipulated. Here the filtering in the frequency domain is which is also straightforward. And when we are going for the frequency domain, we have to follow all these steps. That is, multiply the input image by a minus 1 for express y to center the transform. And the for the computation x of u comma v, and we have to take the a Fourier transform, discrete Fourier, whatever the Fourier transform we have to take. And second, multiply the f of u comma v with the filtered image h of u comma v, and compute the inverse Fourier transform. And then with the result, we are going to get the minus 1 of x plus y. All these steps, when you are going for the frequency domain, all these steps has to be followed with the images. Here we are not going to deal the image a pixel directly. We are going to take the transformation one form to another form, we are going to take. With that form only, we are going to manipulate. That is what, which is a frequency domain. See here, for example, this is the block diagram of the frequency domain. Input image f of x comma y will be applied. That has to be done with the pre-processing, with the and then Fourier transform will be applied and the filter function will be taken. The all these steps will be given in terms of the block diagram. Input image, and that will be taken into the Fourier transform. That Fourier transform will be applied with the filtering function. Next, inverse Fourier transform will be taken it, and post processing. Finally, we are going to get it in terms of the g of x comma y. Ultimately, what we have to get, either the spatial domain or the frequency domain. When you are using, we have to get it in terms of the enhanced image. The final g of x comma y is the enhanced image. So g of x comma, the formula for this will be equal to g of x comma y is equal to h of x comma y into f of x comma y. That is, original image will be multiplied with the image h of u comma v, with the Fourier transforms, and we are going to get the g of x comma y. The basic model for the filtering is g of u comma v will be equal to h of u comma v into f of u comma v. And here for this image enhancing, filtering is also in a frequency domain. Filtering is also take a major part. So for this filtering, we have a low pass filtering, high pass filtering, and band pass filtering. Depending upon our requirement, we can take the filtering. If the image will be, we have wanted in image will be, smoothing is achieved in a frequency domain by dropping out the high frequency components. When we are sharpening the image, we at that time we have to take an into a low pass. So low pass filter only passes the, you know very well, the low pass filter will pass only the low frequency and drop the high ranges, and a high pass filter which passes the frequencies above the minimum values. So for the smoothing function, we have to use a low pass filter. And for this edge detections, for the detecting the corners and edges, we wanted the one means, at the time we have to use the high pass filtering. Okay. And the same thing, because the filtering will take a major role. So the hint, some of the hints for the filtering. Color images are usually converted into, basically for the filtering, color images are usually converted into gray level images before filtering, due to the fact that the information about the structure of the image is represented in the luminous component. When we come, when we convert the gray level also, corresponding features, the particular color grade won't be changed. That we'll see in a later slides. The images are usually stored as a unsigned integer. Some operations could require the explicit cast to double or float for being implemented. The filtered image in general consists of double value. So a cast to unsigned integer could be required before saving it in a file using a predefined format. Uh, we'll deal with the color image enhancement. As I already told you, when you are going with a color image, we have to transform into color space. Definitely, which is required. Whenever you are taking the color image, without the color spacing, the image won't be uh, not properly pre-processed, or what, which is not enhanced properly. We won't get a proper output. So definitely when we are taking the color images, we are supposed to take the different color spaces are there, we have to take the color space. Now what all the color space are there means, we have a RGB to LAB color space, and YH color space, and HSI color space, we'll be seeing in the later slides. So first we will see RGB to lab color space transformation with algorithms, and the YH young Helmholtz transformation, and which is actually a non-linear extrapolation algorithm. Enhancement, which is based upon the wavelet analysis. Enhancement for endoscopic images and the underwater images. So for this color images, first we have to get this, whatever be the images, we have to acquire the image. That is the input image we have to get, and we have to pre-process, and we have to extract their features. After extracting the features, we have to classify that features, and depending upon that category, we have to classify it. And then post processing, what are the things we have pre-processed, no? That we post processed, and final output we have to acquire. Okay, first, here what I'm going to take is a cervical image, because of my specialization is a cervical image. And at last I'll go with the disease identification. This is also one of the, we can take in terms of the entrepreneur, the startup case, because identification of the cervical cancer is a little bit tough. So that we can take cervical cancer as a, one of the main topic. First, this is the image of the cervix image. With this image, this is a colposcopic image. This is a raw image. When you are taking the raw image of the colposcopy, which is in terms of the wet, and the speculum will be inserted on the person cervix. So that speculum, in the sense, it is a steel, like a steel metal plate which is inserted to view the cervix. So that steel, stainless steel, what will happen when which is in a, when we see generally when you go with the any steel vessels, when we take, we'll be getting some glare will be appeared. Okay, we can see our faces with steel vessels also. So what will happen, the glare will the same when you are taking a wet surface. What will happen, the image will be, the reflections will be appeared over there. When you apply the light, what will happen, the glare will be getting is it, so that we won't get in terms of the proper image. Due to this is actually speculum of the stainless steel. To view the cervix, they are using the specula. Okay, speculum for viewing the cervix image. So due to this, and also without the light we can't able to see, correct. So due to that lightning with the steel, the reflection with, due to the light in this cervix, because cervix is a wet, that light, that illumination will fall on the steel also, the steel speculum, that will give the reflection on the original image. So by appearing like this is a this is actually a normal image. By seeing in a raw image, what will happen, this is something lesion will be appear like that, the doctors will be identified. So what we are going to do in the sense, we are going to make in terms of the pre-processing, and then we have to take in terms of the speculum reflection, a region of interest, all the things we are going to see, we'll see, which this major part of the cervix, which is contains the speculum. Okay, these are all the unwanted, only these part we needed. Okay, this is the only part we need for the analyze, and other parts we don't want. So we have to cut this point. So what we are going to apply, we are going to apply for the region of interest for this part. And this is the part of the, because of this speculum we are getting the reflection in the image, original image. This will predict wrongly. So what we are going to do, this also we are going to eliminate. So first we have to go for the pre-processing of the image. Like this, all the images are require the pre-processing. Without the pre-processing images won't be accurate form. Okay, so definitely we need a pre-processing for this cervical image. This only these parts are required, so we have to eliminate all these parts. And we have to remove this reflection. Due to this speculum, we are getting the reflections. That is also we are going to eliminate. We'll see for this steps for the pre-processing: RO extraction and SR removal, that is a speculum reflection. These are all the two parts we are going for the pre-processing technique. This is the representation of the block diagram representation, or else flow representation of the ROE segmentation. First input of the cervix image, and that will be taken in terms of the equidistance this array and RGB to lab conversions. See, because you see this here, the image will be in terms of the pure red. Okay, pure RGB color image. So RGB image, because why I'm insisting that future I'll be giving the explanation of the RGB to lab color space everything. Okay, and equidistance array and estimation of the GMM parameter and mu sigma values, and finally the normalization of the values, array values we have to take it. And here also when your original image will be taken into the lab color space, and that will be taken in terms of the GMM parameter mu and sigma, and that values will be normalized. And finally all these values will be use applying the k-mean clustering, simple algorithm only. K-mean clustering we have to apply. In these values will be denormalized, and finally we are going to extract with the morphological operation. Finally we are going to get the extracted ROI images. And here ROI segmentations, we are this is a segmentation flow we have seen, is it. We'll see depthly. RGB color space, in every color image we have to convert the image, will be in terms of the RGB color space. That color space will be converted into lab's color space. Why I'm converting into a lab? Because for this image I'm taking into a lab color space. Why I'm taking as a lab color space means, L indicates lightness, and A level represents a red or green, and B represents a yellowness or a blueness. Here, in my images, the major part will be in terms of the red. So that I'm taking in terms of the LAB. If I'm taking as a bright lightness which is going into a L space, and A will be in terms of the red or green, and B will be taken into the yellow or blue color surfaces. So I'm going to take A space. L is one space, B is another space, A is another space, B is another space, the third space. So my major part will be the red portions. So I'm going to take the LAB color space. In that, I'm going to take as a A color space. See here, which is the conversion of the lap color space LAB with the RGB image, which is going to convert it into a LAB, L and A into B. Yeah, I'm going to select the A because most of the region in terms of the red is huge regardless of the type lesion or whatever it may be, but huge places huge will be in terms of the A. So I'm going to take as a channel of my LAB color space. I'll be getting a L channel, A channel and B channel. From that I'm going to take a channel. See, this is the RGB. Okay, with this RGB color space, I'm going to take it in terms of the L channel, A channel, and the B. With this original image, already you have seen the original image. With that image, when you take in terms of the color space like this, only we are going to get it. With that, I'm going to take it as a channel only. I'm going to process only my A channel. With the A channel, I'm going to normalize my pixels, and to normalize, I'm going to take the equidistance array and D, and I'm going to normalize with this by using this formula. I'm going to normalize my image. And finally, that color space will be GMM cluster method will be applied, and which is normalized, and K mean clustering is applied on only on the A channel with a 2D array value, and I'm going to get it in terms of denormalization. Finally, my output will be applying the A normalization and K mean clustering and morphological applications. I'm going to finally, I'm going to get only the major part of the A channel. This is what is the ROI, region of interest image. So my ultimate pre-processing first part is the ROI extraction. So I've removed unwanted parts. Only the required part I've taken. Again with the same value, I'm going to take. Now see, this is a as I already told you, this is a reflection. This is not a lesion. By seeing this, doctor may predict this is a lesion. So I'm going to do, that is not a lesion. This is a reflection. I'm going to prove that is a reflection. See, sometimes what doctors will do means they will apply the speculum. As I told you, speculum will be inserted. It's an instrument which is inserted into the human body. Anything which is inserted, even a syringe will make a pain. Doctors, what they will do, it is to identify the lesion. What they will do, they will tilt the speculums, so that will pain the patient. That will make a more, even inserting external instrument will make the human as a pain. Even they are tilting, they are shaking means, again it will make into a, because of the sensitive part, it will make patient as a more pain. To avoid all these things, once when we capture, we can see, we can remove all these things. Okay, the speculum reflections is appear as a bright spot. Have you all seen this? Will be the bright spot. To remove that white spot, what we are going, we are, because of the moistures, everything uneven surface, everything will be take. And this is the block diagram for removing the SR, the speculum reflection. And here I'm going to select as a RGB to HSI color space. So yeah, previously what I've taken LAB color space, here I'm going to take as a HSI color space. Why I'm taking the HSI color space means, I'm going to take the what a H means hue, S saturation, high intensity. So I'm going to take the intensity, high intensity values, so that I'm going to taking from this RGB color space only this high channel I'm going to take. Again, we'll see the formula for the RGB with the small RGB and HSI color space. We are converting into the RGB into small RGB, and then HSI formula will be applied. And with that, we can take it in terms of the normalization value. Intensity, I'm selecting my intensity, which is maximum value of zero point 0.8. If the maximum value means we have to take only that channel. I'm going to take the I channel and the HSI I channel and the S channel I'm going to take, and I'm going to perform saturation and the intensity. With this, I'm going to see I channel and S channel. I'm going to take it without taking the uh, saturated value and also the intensity, high intensity value. The finally the speculum is also removed, so I've proved that this image is not a cancerous image. That what we have seen is not a cancerous lesion, which is a speculum a reflection of the instrument, the speculum. The final, to show you clearly, this is the original image, and with this ROE, and finally uh, speculum reflection also removed. This is what is the this what so far I did is a pre-processing only. And finally, some, if suppose if the patient is having the cancer in the sense that will be happier, how we are going to identify that images, we'll see. For that only, we have to take it in terms of the YH transformation, which is a the next is YH, which is a, you know, which is going to take it in terms of the only the intensity matrix for the high pass filtering. Okay. Another is enhancement for the other enhancement algorithm which is used for other applications. We can use for the high frequency component, and we can split into a high frequency and low frequency component. From that we can take only the high frequency components and high pass filtering, and finally low frequency component we can take and we can perform with the YH transformation. Enhancement based upon the wavelet analysis also there, and color space transformation enhancement, RGB color space, and what all the transformation means RGB, HSI only high HS color space, and next we can take it in terms of the YH color spacing. And this is another image, original image, and this enhanced image after identifying the lesion parts. Okay. And next we'll go for the color image enhancement for endoscopic images, endoscopic enhancement algorithm, and color reproduction algorithm. Here enhancement algorithm, RGB color image will be FIS conversion, and select the enhanced image enhancement on the endoscopy, and will be in new enhanced grayscale spectral images. This is the proposed for the image enhancement algorithm. The endoscopic images, see, this is the original image, and this is a image which will be converted into a grayscale, and then a pre-processing. All these will be taken for the enhanced spectral imaging. Color reproduction algorithm, any color image when you are taking into, we have to convert into a required color space, and that color space finally we have to convert again into a RGB color space, and that is reproduced image. And yeah, not only the underwater the medical imaging, we can also take in terms of the underwater image enhancement also. Yes, input image and contrast stretching of the RGB, transform RGB to HSI, and the saturation and intensity stretching SSI, HSI images and output images. This is a sum of the underwater images. See this compared to this this image, the same image only, after applying the enhancement, the image will be looking like bright, the clear. Okay, that is what we have to apply the enhancement. See, before going for this, all as I told you, not only limited to these diagnosing methods. See, so for what I have explained in the sense, first we have to analyze the blood group, and then blood sugar. We can also identify the blood sugar, and next we can go with the blood with the retinopathy, and then that is sugar with the retinopathy, and the cancerous images, breast cancer, skin cancer. For the skin cancer image also, when we consider, we similarly like this, we can identify and we can use this. Basically, image enhancement. When you use the image enhancement technique, color image enhancement technique, we can identify easily all these diseases, skin and then retinopathy, and skin cancer, cervical cancer, retinopathy, everything. When we go for the special domining, we can identify the breast cancer, because MRI, digital X-ray images, all these things will be going with the spatial domain. Once when you are going for the color spacing, basically color images, we have to go with the spacing. Color spacing is very important. That transformation will be the frequency domain that will give you the accurate result. So which will help the doctors to identify the images accurately. And what are the other images, in the sense, we can go for the types of diseases. We can easily identify the diseases of the blood group, blood glucose, and then diagnosing the diabetic retinopathy, and diagnosing the cervical cancer, or diagnosing the cancer in the sense, we can easily identify. When you know the color spacing, we can apply, we can make that as a startup, diagnosing the cancer center, diagnosing the centers for the cancers, diagnosing a fetal analyzation. One of the main nowadays, in that lots of scanning centers are there. With that identification, they are going with the second opinion, third opinion, so we can make into that. Because in that fetal diagnosing of the fifth month, in that uh, which is very 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 important. So nowadays we can go with that is also, that we can go with the 3D examination of the 3D examination of the images of the fetal images. That is also will give the very good results. And in a cancer images, when we apply the color spacing, when we apply all these one method, if I'm going for the cervical cancer, I can apply for any other skin cancer type. The same techniques I can go with the skin cancer, or else any endoscopic images I can go. And if they're going for the MRI, brain tumors and all, they can go for the spatial domain. And finally, the recursion of the teeth and jaw based on the segmentation. Nowadays, the most accidents are occurring. If they are getting any injury in the head injury, everything, definitely the jawbone is dislocating. Once the jawbone is dislocating, they have to treat them. They have to rearrange the teeth, and by applying the plates, everything. They, by placing the plates, they have to rearrange in a proper shape. For that and all, definitely the image processing will guide them, because which previously which position which will be, and step by step, you, uh, one, it is not a one day process of setting the jaw and bone of the teeth, everything, which will be step by step they have to go for. And they have to analyze what the position of the teeth, what the position of the jaw they have to place in, what how they have to place the teeth, everything they have to analyze. For that, the image processing, definitely the segmentation and will be plays a vital role over there. That image also we can go. So these are all the these are all the some images I'm giving you. There are a lot of images are there to perform this startup. Okay. With this I conclude my topic. There are not only limited to this topic, these diseases we can identify. We can also identify lots of images are there for the startups. You can take any image and you apply the machine learning methods, and we can make in terms of the successful entrepreneur. Thank you very much. At last I'll conclude. When you know this image processing and histogram, we'll be getting it. These are all the references. Some of the references I have followed. Thank you, sir. Sir Navarajan, sir. Yeah, with this, is there any queries? You just raise yourself.
Participants, do you have any queries? You can ask your questions.
Is there any queries? Is there? You just raise your queries.
And there is a question
Okay, sir.
where we can get the medical images.
Yeah, this is a main question everywhere they'll be asking. Actually, when we go for the certain medical, if suppose we need the job one, means we can't get it from the ordinary scanning center and all. We have to go for the dental hospitals. And when we approach the dental hospitals or main GH and all, also they won't give with the proper ethical rules. Only they will be giving the images. In online imaging is also is there, online images is also there. But when you apply this online images on our paper, what will happen, which will show the plagiarism report. If you want the pakka paper, you have to go and approach the dental hospitals. So they surely dental doctors is having the database. Definitely they are taking, and all the equipments is there, and they are taking all the images. We have to approach in a proper manner. Definitely the doctors from the research center of the research center, they'll be giving the images, not in ordinary doctors. Research centers, all the images will be available. Dental colleges, dental research center, like that, for the bone images. And similarly for the cancer image, national cancer institutes will be getting the lots of images. But we have to approach it in a proper we have to get the approval from the mgr university, the Tamil Nadu mgr council, no? There we have to get the proper ethical permissions, and then we have to go to the particular institutions, cancer institution. Sure, they will be giving with some amount will be charged for that, for this procedures and all. And this is about the cancer and about the dental image I told you. And other images will be getting the scan center in famous scan centers will be getting some images, and some doctors is also having some images they will be provide you, and you have to approach the doctors, and you have to first initially when you are going with the medical imaging particular, you have to approach the particular doctors and get the consent. Then only they will guide you. If you believe the doctors, definitely they will guide you, and you have to get the data from them. So, like that only I got. And this is the, because in finally when you are submitting our papers no in a university, they'll be asking the ethical proof, or they are asking. So at that time, which is easy when you are going with the proper channel. Okay, next sir.
Ma'am, can you suggest any recent algorithm for segmentation?
There are a lot of algorithms are there. I can't able to suggest, because well, depending upon the applications, the segmentation may change, sir. Because for a particular image, if I suggest one technique in the sense, if they apply, they won't get, in the sense it will be getting wrong. Depending upon the image, the segmentation may vary, the techniques may vary. So that's what we can't able to suggest the particular method for this image and that image. That's what histogram, the all the things is a enhancement technique, and that is also for one particular image only I can apply for the histogram. If I'm going for this mammogram image for the histogram, I won't get in a proper manner, so they have to apply another technique. So by image to image, the techniques may vary, sir.
Okay, ma'am. Ma'am, I have one question.
Yes, sir.
Image processing is a vast field. How can we make our publications to be in fast in medical imaging system?
Sir, pardon. um
That image, since image processing is a very vast field,
Fast, yes, yes, sir.
how can I make the publications to be in a fast manner? That is, how my paper gets
So you should
published in
not
a
get
very fast.
any plagiarism, sir. That is what the plagiarism, when you, that is what, when you are using the images proper manner, because in plagiarism, images will also get the plagiarism, sir. What the images, a person use the same images, if you are also using the same image means, you'll be getting the plagiarism. That will also give the negative thing. And then your paper presentation, and you have to select and you have to apply, so surely you will be getting the faster, sir.
Okay, ma'am. Thank you, ma'am. Participants, you can ask the questions to ma'am directly. You have any questions? Ma'am, one more question has asked by the participant.
Okay, sir.
Can you suggest some applications of thermal imaging other than breast cancer?
um, Sir, pardon.
Can you suggest some applications of thermal imaging other than breast cancer?
Sir, it's no idea, sir, because no idea.
Okay, ma'am. Then one more question is, in what basis we have to choose the color model to analyze the image?
Yeah, depending upon the color space, we have to see HSI, in the sense hue, saturation, and intensity. No, like that we can analyze our image color by seeing it, by visually. When you are seeing itself, we can identify the color space. By that, we can apply what channel will be suits for my images. What the thing, if I have a brightness, I have to take there, have to use a eye channel. And if I wanted to take the red or green color is dominant, I wanted to take the particular pots, in the sense there have to take the a channel. So depending upon that, how to convert one space into another space, I have to take the particular channel.
Okay, ma'am. Any other queries? Participants, do you have any other queries? Arun sir.
Okay, so we can formally conclude, sir. Thank you,
Oh,
ma'am.
oh,
Thank you for
okay,
your
okay, sir. Uh,
Thank you for the team for organizing such an event. Thank you, sir.
okay. I thank the speaker for contributed a valuable and very effective information about medical imaging and various aspects and